James Davis.
Thank you, Chair. Dr. Matthew Jolly, I'm keen to explore with you the idea of a third routine ultrasound scan, largely at term, to determine breech presentation. This is something that was pushed by Professor Gordon Smith when he spoke to us in December. Do you agree this can save lives and also reduce asphyxia during birth and birth trauma? Is it something you would support?
Absolutely. I've been working closely with Professor Gordon Smith on this. There are a relatively small number of tragic deaths and brain injuries related to breech, but each individual really matters. And if there's something we can do about it, we should be doing something about it. I have huge respect for our National Screening Committee, and there are reasons we have the processes in place for making sure that we don't do unintended harm through screening. So I will obviously respect their opinions, but for my less expert view on screening, it seems like absolutely the right thing to do. And the scan is very specifically just looking for breech. It's not a growth scan. It doesn't have some of the unintended consequences of other scans. So I'm hopeful that it will see the correct the support and we'll be able to roll that out. But I have to wait for the screening committee to come up with a final decision.
Understood, yes. I mean, we were told that it could be a point of care scan delivered by trained midwives or other clinicians as opposed to clogging up the existing scanning systems. And you'd agree with that. I mean, how do you see it would be implemented? Is it a simple process?
Well, in my own unit, we've actually started introducing midwifery scanning on the labour ward as part of our induction process. And so I'm training midwives at the moment in presentation scans, and they're enthusiastic and perfectly capable of it. It's well. I mean, midwives are really skilled, and this is well within their capabilities. So yes, I think it's perfectly achievable.
Understood. And if I could turn to the Minister, Nadine Dorries, to secure her views really on this agenda, whether she would help to push it through should the screening committee agree.
Absolutely, and I'll just echo the words that Matthew just said in terms of small numbers. People often say to me that the number of babies who lose their life as a result of Group B strep, the numbers are small. It's on average 1 a week. And it's on average 70 babies a year who live with lifelong disabilities as a result of contracting either meningitis or sepsis as a result of Group B streps being present in the birth canal. And I see at the time of delivery, and I see both of these things actually coming together. I know Matthew and I discussed this, and I know there are some. One of the hurdles has been jumped over in terms of training midwives to undertake this scan at 35 weeks. It doesn't give the detail that in terms of sizing and other things that you would get from somebody if you were having a full scan, but it does allow the midwife to know if the baby's breached, and therefore it provides an extra element of safety during the birth, and therefore it's something I absolutely support. And I know that Professor Jackie Dunkley-Bent and Sarah Jane and others who work in this field would put their absolute, and myself, their shoulder behind it to make sure we got that rolled out as fast as possible. But I would also just like to, because I don't want Group B strep to be the forgotten relative in this, I would also like, it's the same time, 35 to 37 weeks, although Matthew would say there's some variation in that at times. But I don't see any reason why, if we're going to scan mothers at 36 weeks, why we also don't swab them at the same time for Group B strep. I absolutely will put my weight behind it.
And there are no barriers to funding.
I think Matthew...
Never.
Well, £11 a test for Group B strep. I can tell you how much. I'm roughly 360,000 births a year, so I can give you the costings for that. So I would do my absolute best to ensure that there was no gap for funding for that. Matthew would have to tell us what the costing would be for the scans. But, I would even see, Matthew, you might contradict me on this, and please go ahead if you do, but I would think the scanning equipment to be used. I know that in A&Es, they receive these out-of-date scanning equipment that comes from scanning rooms into accident and emergency units. I know some of them have a surplus, but it doesn't have to be the most up-to-date, expensive scanning equipment to be able to tell if a baby's breech or not. Am I right, Matthew, or would you like to contradict me on that?
You're right to an extent in that you don't need the most sophisticated scanning equipment to tell whether the baby's breech or not. I think Professor Smith's vision is that actually there would be easily handheld scan machines that midwives could carry with them and use in the community. And you don't want to be carting around an old scan machine in the back of your car. So I think there's some new technology that's going to make it even more deliverable. I do not have the costing data available, and I suspect that there's all sorts of clever things in procurement where we don't want to commit to a cost now. I think we've got guys who want to negotiate the best value for the public's pocket as they can. So I'm not going to speculate on the cost.
Thank you. It all sounds promising.
Thank you very much, James.